All right, now this slide that I want to talk about today, all right, is probably the most important single slide. If you understand the content of the slide, you will then understand what happens electrically, what happens with the pressures, what happens with the blood volume, and what happens with heart sounds, and how they all relate. So let's discuss what happens first with an EKG here. At the very top, then we'll go talk about all these different factors here. So first thing we see, for the heart to contract, you will need to have a P wave, right? P wave is caused by the atria depolarizing because of the activity of your sinoatrial node. As the sinoatrial node fires, it causes the atrium on the left and right sides to depolarize, and because they're depolarizing, you're having this P wave occurring upwards. Right? Now, as a P wave occurs upwards, we should also start seeing then a slight increase in the pressure in the atrium. Makes sense? You're activating the atrium will then contract. So in the black line on this second graph, you'll see a slight bump in the pressure of the atrium. The atrial pressure is found in the black solid lines again, right? But notice that the actual pressure doesn't start until halfway through the P wave. Remember, it takes a little bit of time for the actual contraction to occur. And the contraction only occurs slightly after the halfway point right here. But once a contraction occurs, now we should be ejecting blood from the atrium into the ventricles. So we should see a slight topping off of blood from the atrium to the ventricles. And this is what we see in this third chart. In the third chart, we see before the atrius contract, we're about 110, maybe 105 milliliters of blood. After it contracts, it finishes up and top it up, and now at 125, right? At this point, nothing has really moved, right? All we're doing is finishing off our filling of the ventricles, right? Now, what we see next up here is that you should see the QRS complex. Again, QRS is an activation or depolarization of your ventricular muscles. The ventricular muscles will depolarize as a result of your AV node, atrioventricular node. As the AV node depolarizes, it stimulates the ventricular muscles, both the left and the right, eventually, to depolarize as well. So the presence of the QRS is a sign that we have a good AV node function, right? Now, halfway through the actual depolarization of the ventricles, the QRS, we should see halfway through, right, the ventricles start to contract, right? Again, what we notice is, right, as it starts to contract right here, in the black here actually, is the ventricular pressure, right? As the ventricles start to contract, almost immediately, right, it goes from about 10 millimeters of pressure up till about 80, right? In the process, to prevent backflow, because now you're squeezing from the apex, right? As you squeeze from the apex to prevent backflow of blood into the atrium, what do we need to do? We need to close your mitral on the left and your tricuspid on the right, right? As the mitral and tricuspid valves closes, right, we should hear a heart sound. That's what we hear. You always hear heart sound when there's closure of the valves. This is the first closure of the valves, the first heart sound, and the first heart sound is a sign that we are in ventricular systole. In other words, ventricular contraction. As you contract and contract and contract, the main job is to sustain the contraction so then we can move blood into the aorta. In the red line right here, that's a pressure in the aortic valve. That's a pressure because you have blood sitting on the aortic valve from the previous contraction. In order to even open the aortic valve, you need to overcome this 80 millimeters of pressure. All right, what happens? The ventricles contract, builds up pressure. Eventually, ventricular pressure exceeds the aortic pressure. When that happens, you pop open the aortic valve. As the aortic valve pops open, you keep contracting, and as you keep contracting, you keep pushing blood from the ventricles into the aorta. At this point, notice you can see that the black line and the dotted red line mirror each other. The reason is, right, as the ventricles start to keep contracting, ejecting blood out, the blood that goes into the atrium, or goes into the aorta, let me repeat that, right? The blood that goes into the aorta will receive blood under that same pressure. That's why you see these pressures here very, very closely related. Now, as we keep ejecting blood up, right, there comes a point where the ventricles itself needs to relax. And that's what the T wave is. The T wave is ventricular repolarization. It will cause the ventricles to relax, right? Halfway through the T wave, we see a drop in pressure here. The ventricles can only contract for so long, and what happens then is as it starts to lose pressure when it relaxes, it's still ejecting a little bit of blood out, but eventually, right, we'll notice that the aortic pressure exceeds the ventricular pressure here. As the aortic pressure exceeds the left ventricular pressure, blood moves back down the aorta. At that point, the aortic valve closes, right? As it closes, we should hear another heart sound. Now, in that span between the opening and the closing of the valve, you have a period of ejection. This ejection period, then, we should be able to see a drop in the amount of blood in the ventricles. Reason for it is because the ventricles then, that blood that's going out of the ventricles goes into the aorta. And that's what we see here, right? Right before we contract it, we're at a maximum, 125. When we open the aortic valve, we start ejecting blood into the aorta. So it starts to leave the ventricle, and now you see a dip in the ventricular volume, right? At this point, we reach the lowest volume possible, right? At that point, up in the pressure graph, the aortic pressure is greater than the ventricular pressure. What happens then? Blood moves all the way back, closing the aortic valve. As you have closure of the aortic valve, you again hear the second heart sound. At this point, the pressure in the left ventricle starts to drop all the way to 0. At the same time, blood is returning from the body into the right atrium. Blood is returning from the heart into the left atrium. And that's what we see here, right? As there's less pressure in the left ventricle and more pressure in the left atrium, the atrial valve opens up, the mitral valve opens up. As it opens up, blood then passively moves from the atrium to the ventricles. And we can see that as this increase in blood volume, that is very passive. This increase in blood volume that's very passive is due purely to passive flow of blood from the left atrium into the left ventricle. Now we get ready for our next set of contraction. Over here, we have a P wave. Again, that P wave is caused by the SA node firing. Halfway through the P wave, the left atrius contracts in light blue, which causes blood to top off, and now we see the maximal blood volume right here. At the same time, the SA node fires, right? It causes the AV node to fire right here. As the AV node fires, we activate the ventricles again. Ventricles depolarize. Halfway through, the left ventricular pressure moves up, 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 up. When it exceeds the pressure in the aortic valve, opens it up, and now we have blood movement into the aorta. Eventually, right, the T wave is seen, and then the left ventricle has to relax. As the left ventricle relaxes, the pressure drops and drops. Eventually, the pressure in the aorta exceeds the pressure in the left ventricle, and the aortic valve closes again. Again, our second heart sound. All right? Now, when you're looking at this graph, right, it can be very confusing. Take a look at it from the top down, right? It should relate. Now, the pressure graph, if you look at the pressures, obviously, this is solely talking about pressure in the left ventricle and the left atrium. The right side of the body, the right side of the heart, will be very different. It doesn't get to anywhere near the 120 millimeters of pressure. So the graph itself would have been much smaller, all right? Now, again, if you understand this chart, you're in pretty good shape. I will have more of these kind of, videos coming up.